thyroid gland governs your metabolism and your liver, intestines, reproductive system, brain, heart, and kidneys. So thyroid health should be a concern to all women. If you are experiencing signs of depression, it could be directly related to thyroid disease and could be easily treated without antidepressants or other medications. Hello and welcome to Village the Vitamin Store. I'm Dr. Fahad Barani, and in this video we're focusing on thyroid disease. Let's join the presentation as Angela talks about the effects of thyroid disease on your overall health, the common signs and symptoms of hypothyroidism, and offers some practical solutions for maintaining thyroid health.
Thyroid disease affects many body systems and your overall health. So it's important to know this, because if you're someone who has low thyroid or suspects low thyroid, you may want to take a look at this, because it can affect you in a whole bunch of different areas. And it can make you feel horrible, absolutely horrible for some. Quite often, actually, the signs of low thyroid will mimic the signs of depression. So it may be something for you to consider if you do feel like you may be suffering from depression, is to take a really good look at the symptoms of low thyroid as well, and maybe suggest to your doctor to get a thyroid test to see where you're at, because sometimes you just correct the thyroid imbalance and the depression goes away. What happens when you have low thyroid? You get increased LDL cholesterol, elevated triglycerides. Your intestines will cause constipation. Your thyroid gland governs your metabolism, it governs your energy, it governs how fast your cells move in your body. So if it's low and slow and running low, you're not going to be having normal bowel movements and whatnot. So it's going to cause things like constipation. Also, anemia and low iron are attributed to low thyroid as well. And these two symptoms are very similar too. Low thyroid symptoms are very similar to symptoms of anemia, but the two go hand in hand. So quite often, and I've dealt with a number of clients this way, where you kind of treat your thyroid and the low iron together until you get everything up to par, and then you go from there. If you have low thyroid, yeah, you won't be able to get pregnant. If it's low, it really affects your fertility and also menstrual abnormalities. So if you're someone who has that really light periods or really irregular periods, like all the time, then you may want to consider looking at the thyroid. It also may harm development of the infant. So if you do get pregnant and you're pregnant, you just want to make sure that you keep taking your medication if you are, because we want to keep the thyroid going. The brain as well. So depression, like I was saying, a lot of the symptoms of depression are the same as that of low thyroid. Decreased concentration, general lack of interest, and no sex drive. This is where you don't even think about it at all. It doesn't even cross your mind. And then irregular heartbeat, decreased or increased blood pressure, decreased cardiac output, and then the kidneys. So decreased function of the kidneys, fluid retention and edema. And this also gets into a little bit of the adrenals. The adrenals and the thyroid also work, if they're both kind of underactive or low, there's a feedback mechanism there. So if this is the case and you're finding that you're having decreased function of your kidneys and fluid retention and edema, you probably want to also work on your adrenals at the same time. So you want to just kind of look through all of your symptoms. So tiredness, constipation, loss of interest, forgetfulness, dry, coarse hair, hoarse voice, loss of the eyebrow hair. So that's when you lose the last half of your eyebrow hair. Puffy face and eyes, that's when you get the puffiness over your eyes, and it's just that look of, you feel like you need some collagen or something to boost your eye up. Goiter, anemia, irregular heartbeat, dry skin, cold intolerance, weight gain, heavy menstrual periods, brittle nails. You know, the nails tell you so much about your health. It's amazing. If you have brittle nails, or if you have spots on your nails, or you have ridges on your nails, they tell you so much about your health. It's really interesting. So you may want to take a look at your nails, and if you do notice that they aren't smooth, or they have white colorings on them, or they're brittle, it can really be helpful for indicating what's going on inside. So this is where we get into the test. So have your thyroid checked. Normal at the doctor's office is 0.5 to 5.5, but your TSH should be below 2. So for some, it's right on 2. For others, it's like 1.7, 1.8, 1.9 in there. So it's, even though it doesn't seem like a huge range, it actually is, and it makes a difference. So once you feel amazing, it's good to get the TSH tested so you know what your number is, and then just try and keep it within that. number. So what does Thyroid Smart contain? Well, it has ashwagandha in there, and ashwagandha, it's an adaptogenic herb, and it helps to increase your T4 hormone. And then Camphora mucil, it enhances the conversion of T4 to T3, and they both herbs work to boost your thyroid gland directly. So not only are you boosting your T4, but you're helping with the conversion of T4 into T3. And T3, most people are on levothyroxine, which is T3, and so you want to make sure that you are taking something to help boost your T3. So a lot of questions that we get asked are, can I take Thyroid Smart along with my medication? And the answer is yes, as long as it's an hour away. You usually take your thyroid medication in the morning on an empty stomach, and then you could take your Thyroid Smart an hour later with your breakfast, 2 capsules, and that'll help with the uptake of it. So that way you don't have to increase your dose of your thyroid hormone or your medication. Potassium iodide is in there as well, and that's used to make thyroid hormone. And then tyrosine as well is used to make thyroid hormone. So the protocol for low thyroid is Multi-Smart for complete nutrient support, 2 Thyroid Smart with breakfast, and make sure at breakfast you do have protein, whether it's a protein smoothie or a shake, eggs or chicken breast. And it's not for those with hyperthyroid, so that's somebody who has a very overactive thyroid. That's a completely different thing. And it can and should be taken with your thyroid medication, as I mentioned.
Now you can see how important it is to maintain thyroid health. The first step is to get your doctor to prescribe a free T3 and T4 thyroid test. This will give you the baseline information you need to seek treatment. If you have low thyroid levels, then Lorna Vennerhaeg's Multi-Smart and Thyroid Smart could be right for you. I invite you to get your thyroid test completed, then take your results to any of our Village Vitamin Store locations in Southern Ontario and speak to our supplement specialists to discuss the options that are right for you. Thanks for watching. I'm Dr. Fahad Barani, encouraging you to achieve wellness through nutrition.